Hi, my name is Riham, and today I'm going to be talking about why dental care should be fully covered by health insurance. Dental care is a necessity, not a luxury, yet our current healthcare system treats it as an afterthought, leaving millions unable to afford basic treatment. This must change. Unlike general health care, dental insurance is often separate or limited, making it difficult for individuals and families to receive the care they need. Our healthcare system fails to recognize that oral health is directly linked to overall well-being, and it's time for full dental coverage to be included in standard health insurance policies. Right now, dental insurance isn't included in most health plans, forcing people to either pay out of pocket or go without treatment. Even those with insurance face high copays and strict coverage limits. A simple filling can cost hundreds, and a root canal can be over $1,000. According to the Centers for Disease Control and Prevention, CDC, millions of Americans lack dental insurance, leading to untreated dental diseases that contribute to higher overall healthcare costs. This means families must choose between paying rent or fixing a painful toothache. No one should have to make that decision. The consequences of inadequate dental coverage are severe. Cavities turn into infections, leading to life-threatening conditions like heart disease and diabetes. According to the American Dental Association, ADA, poor oral health is directly linked to chronic diseases such as heart disease and diabetes, proving that dental care is not separate from overall health. Poor oral health also affects mental health, self-esteem, and job opportunities. Some argue that dental care is separate from overall health, but research proves otherwise. If untreated oral infections can lead to serious illnesses, why isn't dental care treated as essential in health coverage? So, what's the solution? The answer is clear. Dental care must be fully covered by health insurance. Expanding coverage would prevent costly emergency treatments, improve overall public health, and reduce financial strain on families. According to a study published in Health Affairs Journal, integrating dental care into health insurance plans could help lower overall healthcare costs by reducing emergency room visits and promoting preventive care. Some argue that this would increase insurance costs, but in reality, preventive dental care saves money in the long run by reducing expensive emergency procedures. In fact, policymakers are already discussing this issue. The Senate Health, Education, Labor, and Pensions Help Committee recently held a hearing titled Examining the Dental Care Crisis in America. How can we make dental care more affordable and more available? This discussion highlights the urgent need for reform. Here's a clip from that hearing where experts discuss the gaps in our current system and the need for policy changes.
When we talk about the healthcare crisis in America, I'm afraid that far too often we ignore a very important aspect of that crisis, and that is that tens of millions of Americans are either unable to afford or unable to access the kind of dental care that they need. As a result, there is widespread suffering throughout the country that largely goes unseen. This is an issue really that is not talked about anywhere near enough. And I have distributed for the members of the committee just a number of statements that we assembled from all over the country. We did send out an email in Vermont, which, as you know, is a very small state. We got 500 people who talked about the cost of dental care or their inability to access dentists, and we got 1,000, I think, nationwide. So this is an issue I think that's on people's mind, and I think it's an issue worthy of serious discussion here. Today in America, nearly 70 million adults and nearly 8 million children have no dental insurance, and many of those who do have dental insurance find that coverage to be totally inadequate. In fact, nearly half of Americans who have dental insurance have skipped their appointments because they could not afford to pay for the dental procedures they need now. We need to understand that when nearly half of adults in America have some sort of periodontal disease, it makes them 2 or 3 times more likely to have a heart attack, stroke, or some other serious cardiovascular emergency. We need to understand that when your teeth are in bad shape and you cannot chew your food properly, you're in great risk of diabetes, digestive problems, and poor birth outcomes. And there's something else that we don't talk about, that it's not just health. When we see people without any teeth in their mouth, that is a symbol that they are poor. Walk in, try to get a job without any teeth in your mouth. Good luck to you, because you're not going to get it. We've got to understand that if we're going to seriously address the dental crisis in America, Congress is going to have to act, and act boldly. And that's why I've introduced today what I believe is the most comprehensive piece of dental care legislation that we have ever seen in our country.
Additionally, efforts are being made in Canada to expand affordable dental care accessibility. Health Canada has been working on policies to ensure that more people have access to necessary treatments.
Thanks to this program that the Liberals and NDP put in place. And the federal government says with this expansion that they're announcing and promising today, more than 5 million Canadians will be able to soon possibly access dental coverage.
What we can learn from their system. Closer to home, there are community dental programs that provide care to low-income individuals, seniors, and those with special needs. These programs show that affordable dental care is possible if we prioritize it. Here's a look at Michigan's efforts to offer free or low-cost dental care to those in need. To show you that this issue is more than just statistics, I asked two of my friends about their own experience with dental insurance. Tanzima shared that she's had to delay dental care multiple times because of insurance problems. Even when her insurance did cover part of the cost, she still had to worry about copays and whether or not her plan was even accepted by local dental offices. She told me how frustrating it is to wait weeks to reapply for coverage, only to be stuck in long lines on the phone with representatives who can't even guarantee answers. She said, "Imagine being the 76th person on hold, just to be told they can't help you." Anna, on the other hand, had a more positive experience. Her insurance allowed her to get work done on 6 teeth this year. While she did have to space out appointments because not everything could be covered in 1 year, she still felt satisfied with the coverage overall. Dental care is something everyone needs, but too many people in the U.S. still can't afford it because it's not fully covered by health insurance. I've shown how this affects real people like the friends I interviewed and shared examples of programs in places like Canada and Michigan that are trying to do better. The current system makes it hard for people to get the care they need without stressing over costs, delays, or confusing coverage. That's not okay. Dental care should be treated like any other health care. It should be affordable and accessible to everyone.